Squatting is one of the most common exercises in rehab and the strength and conditioning world. But how many times have either you squatted or you've been coaching someone and you see a hip shift occur? We've all talked about the knee valgus and the excessive anterior pelvic tilt, but what do you do when you visually observe your patient go down and start to deviate and shift their hips to one side? I think it's a tricky subject, but hopefully after this video, you find it very clear to understand A, why this is happening, and B, how to fix it. So let's start with the why. A normal squat remains very vertical throughout the entire range of motion. A squat with a hip shift starts vertical and then either deviates to the left or deviates to the right. To simplify this, I just want you to think of a locked door and an unlocked door. If you approached a locked door and pushed on it and you didn't have the ability to open it, would you be able to walk through it? No. If you approached an unlocked door and you pushed through it, would you be able to walk through it? Yes. Think of that same mindset and framework when it comes to the hip shift during a squat. When you see someone deviate towards a side, that is telling you that that side is unlocked. Why? They're moving through it. If it was locked, they wouldn't be able to move through it. They hit a constraint, they would have to move away from it. So, if you see a left deviation, that means that this left posterior outlet is unlocked and the right side is locked. What does this mean when it comes to anatomy? Eccentric, open, concentric on the right, compressed. When the body reaches a compressed space, i.e. the right side here and an open, it's going to move away from the compressed and move towards the open. Just like if you went to an unlocked door, you would have no problem moving through it. But if it was locked, you'd have to find a different route. A hip shift during a squat is just your body's attempt to find a different route. Now that we understand that, let's talk about how to fix it. So when we see a hip shift, a lot of people want to automatically stretch because they think things are tight. In actuality, we want to shift. Why? Because we already said this is a hip shift. We want to work on shifting in the opposite direction. Now, to get really clear as to where you shift and what exercises are going to be best, that ultimately comes down to your assessment. For this video's purpose, we're just going to go over one example. If you want to go over a lot of examples and understand how your assessment tells you exactly how your patient is positioned, then I would encourage you to check out the Clinical Coaching Foundations course. This is an online program that goes into assessment and coaching and programming to really get your patients out of pain and maximize their results. I'll leave that in the link below if that's something you're interested in. Now back to this video. Let's use an example that the person is deviating to the right. What does that mean? If you're confused, think about the locked and unlocked door analogy. If they're deviating to the right, the door is unlocked. That means that they're in this orientation here. The right's open, the left is compressed. So what does that tell you that we need to work on? If we just stretch in this position, we are furthering that person's dysfunctional squat because this remains compressed and then we stretch a leg. So we're not truly fixing the source of the problem. To fix it, we need to create the opposite. We need to shift. We need to lock what's unlocked and unlocked what's locked. That's how we start to do it. And that's how we get intentional when it comes to fixing a hip shift. So let's talk about 3 simple exercises that we can implement to fix a right hip shift. The first exercise we can do is completely passive, but it's passive with intent. We're not just blindly stretching. It's a little bit more of a dynamic stretch, but the key here is the intent. We are trying to shift the pelvis to the left for a very specific reason. So we can use an RX pad or a yoga block, and you will throw the left leg up on it. When we're doing this, this is shifting the pelvis to the left. The right is down, the left is back. We're unlocking the left posterior outlet. From here, you can bring the right knee slightly forward compared to the left, go in a all fours position, and we're just going to work on shifting diagonally back. I'm not shifting laterally. That's just going to get the hip. We're trying to elongate tissues while in this hip shifted position. Now, a couple things you can do from here. You can eventually go down here. It's going to make it a little bit more challenging, and you should start to feel that. And you can take the leg in the back and actually hook it across the leg. This is just another way to start to intensify that. And as you're going through it, make sure you're breathing. What I would focus on is inhaling as you go back. Hold it for a couple seconds. Exhale as you come up. So find the variation that's best for you. Remember the intent behind it. Shifting the left, eccentrically orienting and expanding the tissues at the left posterior outlet. Next, we're going to go into more of an active hip rotation. Go in a side-lying position with the feet on the wall and the head supported. Head supported, really important so you're not having neck pain. Feet supported, really important to make it a closed chain exercise so that the pelvis is more in control instead of the femur. So when we go into a left pelvic rotation or hip shift, we're essentially going to internal rotation on this left side. So we want to start to get hamstrings, the inner thigh, and glute on to help us internally rotate the pelvis. So from here, what you're going to do is find a neutral pelvis position, stack the pelvis under the rib cage, get a little bit of pressure into the wall to feel a little bit of the glute, downward pressure into the knee, and then work on drawing back without arching your back. So an easy way you can monitor this is to put the thumb on the hip bone, the ASIS, and spread the fingers across the glute. Feel that slight rotation. As you rotate back, you shouldn't feel this hand spin. There shouldn't be any spinning. So you're going as much as you can, and then you go forward. Inhale as you go back. Give it a hold. Exhale as you come forward. So every time we are pulling back, we are going into a left hip shift, which is left internal rotation. We're trying to feel hamstring, inner thigh, and glute. Now we're going to challenge the strength and the dynamic ability of the hip rotation. So a split stance wall deadlift is perfect for this. What you're going to do is you are going to put the right foot on the wall, completely vertical, the ball between the knees, so that way you can continue to drive slightly in to maintain that internal rotation through the adductors. We're going to grab a weight, and all you're doing is reaching this hand back as you push your hips or hinge back and reach for the big left toe. As you come up, you're just going through the opposite. The key here is that you're truly hinging back. We're not squatting. You must feel this back pocket as you go down. This right here needs to be left back pocket. That means that we hinged. If I feel my quad and or lose my position here, it's because the knee pushed forward. We squatted it. We really have minimal knee bend. The knee doesn't really move much. We just push the hips exactly back towards the wall, reach back, touch the wall to add that rotation, and then you come up. Again, a great way to start to fix a hip shift. Notice how we're not doing any squats to fix the hip shift. We are improving the pelvis positioning to fix the hip shift during a squat.